So like in case of education, there was criticism of how 18th Amendment devolved many of the functions to the provinces. There were many people, many experts in the federal government and outside, which argued that this change will not help the people of Pakistan. So, what was the situation before the 18th Amendment? So, in the pre-18th Amendment ministry, there was Ministry of Health, and it had many important roles to play, but it didn't have capacity. So, there was it was a very small ministry. It had to look to the health sector, which has expanded to all the 4 provinces. There was overextension in some areas, like supervision of autonomous bodies. Then there was fragmentation of functions between autonomous bodies, ministry, provincial departments, and other agencies. So all these problems were there with the pre-18th Amendment Ministry of Health. The main functions of Ministry of Health before the 18th Amendment were national policy coordination, international health and donor coordination, human resource development, standardization of manufacture of drugs and licensing of drugs, prevention of infectious and contagious disease, vital health statistics. So all these were the areas in which Ministry of Health was competent to work on. Then there was different vertical programs which were paid and financed and administered by the federal government, but would actually worked all over the country. For example, National Program of Primary Health Care, Tobacco Control Program, National Program for Control of Aviation Influenza. Then there were many attached department and subordinate offices of the Ministry of Health, which include National Institute of Medical Sciences, PIMS, Islamabad, Jinnah Postgraduate Medical Center, Karachi, Federal Government Services Hospital, Islamabad. The subordinate offices were Central Drugs Laboratory, National Control Laboratory. Then there were many autonomous bodies which also worked under the Ministry of Health, which include National Institute of Cardiovascular Diseases, National Institute of Health, Islamabad, National Health Services Academy, Pakistan Institute of Pakistan Medical and Research Council. So all these were different areas and bodies where Ministry of Health could work. But after the 18th Amendment in 2010, Ministry of Health was devolved in June 2011. But it was realized soon after that a federal level Ministry of Health is going to be essential for the working of health sector in the country. So the Ministry of Health was recreated in May, 2 years after, May 2013, as Ministry of National Health Services. And its focus was shifted to more to coordination and regulation. So despite problems which existed before the 18th Amendment, the Ministry of Health the new Ministry of Health Services had considerable role. For example, in the regulation, in the coordination, policy, international commitments. All these were some of the areas which the new Ministry of Health Services can work on. So some of the areas which were given to the new Ministry of Health were health information and research, health regulation, international commitments, national health policy. So these were the areas which were given to the new Ministry of Health.